Greeting, I'm Kamsamali and welcome back to more updates of the Cambodia-Thailand border conflict on CNC News. As you may have known, it has been more than a month and displaced peoples are still at the refugee camps, and more negotiations and more meetings are being held between Cambodia and Thai side. And beyond this, more social protections are needed for civilians and vulnerable people. And today we have a special guest joining us coming from the UNICEF, Dr. Lisa Marie, who is the Chief of Social Policy. Greeting. Thank you for joining us today.
Thank you for having me.
In regard to this matter as a whole, how do you see vulnerable people are affecting from this? What are the causes that you're seeing?
So the emergency, of course, came very unexpected. So for the most vulnerable families, most of them had to leave their homes very sudden without anything. So they were found in the camps without even clothing, food, and very basic things. So for them, the needs are very many. So from shelter, clothing, food, health, and of course there is an interruption of basic services. So the risk of diseases or malnutrition increases as well.
I see. And as you're also, the core focus is on children, and so schools have been closed a lot. So how is UNICEF contributing to learning continuations to this matter?
Yeah, so UNICEF works quite closely with the government and the Ministry of Education to make sure that children can still access learning materials in digital format, or we also create learning spaces in the IDP camps, which at least ensures a continuation of learning for children, which is necessary.
And do you have any contributions coming from youth joining into providing assistance of learning to children?
Pardon?
In regard to those learning continuations, do you involve many youth who would volunteer to join in providing learning and educations to displaced children?
Yeah, so in the camps, of course, we also have youth advocates that would support the learning centers, and overall we have many youth groups that are actively engaged in supporting vulnerable children during these times of crisis.
I see. And besides this, what are the social protection systems that serve in preventing such as malnutrition and other disease?
So we are in a good situation in Cambodia. I would say the government has been very committed towards social protection. So the family package, which is a national system of cash transfers for the most vulnerable groups, including families with school-going children, pregnant and lactating women, persons with disability, the elderly, and also persons living with HIV/AIDS that are receiving regular cash transfers through the family package. And UNICEF has been working quite closely with the government to ensure that these services are not interrupted during this crisis intervention. What does that mean? That in the camps we have government officials from the National Social Assistance Fund present who make sure that families can access their monthly cash transfers even in the camps and being far from their homes. So that has been one of our key efforts as UNICEF and other partners. We are also reviving the cash working group, where we're working together with other UN agencies and NGOs towards getting additional cash transfers in this emergency. There's also been a waiving mechanism in place so that the access to cash transfers has been a bit easier during these times at the moment.
Thank you so much for highlighting that. And beyond this, I want you to address on children's mental health and also mental well-being, and how are they during those times of conflict in terms of social protection?
Of course, it's difficult times, so we're also working closely with the government to ensure that there's a solid workforce that is trained on psychosocial support to provide that support to children that, of course, are at risk of neglect. They have so much to digest, and very often it's too much for them. So besides having educational spaces, we also have child-friendly spaces and psychosocial support in the camps.
Could you highlight on this, what are the common costs of children in terms of how their feelings right there at the camp?
I think mostly it's anxiety, and some of them are very hopeless. We've seen it in children. Of course, they're also seeing their parents being quite despaired. So I think many children need to be encouraged, they need to be given hope, they need to have their daily routine, they need to still continue learning, access quality food, wash facilities. So I think making sure that all the basic needs are met is already the first step also for their psychosocial well-being. I mean, maybe just to let them know that we see you, we see your needs, and we are there, we will be there, and we're working quite hard with the government and other partners to support you as much as we can.
And this is the end of our interview regarding social protections to children and especially displaced families at the refugee camps. And thank you so much for watching CNC News on this update of the Cambodia-Thailand border conflict.